Well, good afternoon, everyone. President Biden has been in office for less than 2 days, and already there's a noticeable difference in the effort to listen to and be responsive to the needs of the states. So far, it appears that addressing COVID is his administration's top priority. Hour by hour, his team is seemingly unraveling the mess the previous administration left behind and focusing on improving vaccine supply and administration. Just yesterday, on the first full day of the Biden-Harris administration, the president signed 10 executive orders designed specifically to address this pandemic, including something I've been calling for, the invocation of the Defense Production Act to improve the supply chain that we need to enhance vaccine production, as well as increase testing and treatment therapies for Illinoisans and for all Americans. He's also asking Congress for $20 billion to expand vaccination centers and mobile clinics beyond what we've already planned, and for funding to hire 100,000 new public health workers to build up our nation's underappreciated and understaffed public health infrastructure. I've made clear to Illinois' congressional delegation the need to take up this legislation immediately. 48 hours into this new president's term and 11 months into this pandemic, it finally feels like help is on the way. It's in that context that I want to provide an update on the progress of Illinois' COVID-19 vaccine administration plan. What we've done and where we're headed next is what I want to present. This week, our Illinois National Guard mobile vaccination teams have begun operations at 6 vaccination sites in Cook County, working in partnership with the local public health department. And over the next 3 weeks, approximately 25 additional National Guard vaccination teams are deploying to more sites in high-need areas all across the state. That's on top of the soon-to-launch sites in St. Clair County that I announced last week. Let me pause to just acknowledge the heroic efforts of our Illinois National Guard, who have deployed to not only stand up mass vaccination sites, but also to protect the inauguration in Washington, D.C., and to protect our state capitol complex, all just in the last week alone. We all should be so very proud of our Illinois National Guard. They are considered among the best in the nation. The Guard is just one piece of our state's vaccination administration. They work in conjunction with the 97 local health departments who are all on the front lines and taking on the responsibility to vaccinate their communities at a scale never before seen, while also navigating a completely inadequate national supply of vaccine. Local public health departments are locally operated and funded, and you can imagine how challenging this pandemic has been for many of them. Imagine the work that they have to do, so vitally important, and not having enough staff or not having enough resources. So we've been there to try to help them, to lift them up. We've seen incredible work, though, among those local public health departments across the state, and I want to highlight 2 such examples. In Quincy, the Adams County Health Department has already ramped up to administer over 1,100 vaccines a day in a community of 65,000 residents. And in Greene County, about halfway between Adams County and St. Clair County, their health department administered their entire federal shipment last week within 24 hours of delivery. These are far from outliers. This week alone, Illinois set 3 days of records for vaccine doses administered, and not just by squeaking by. Our new high blew past our last by more than 10,000. That is to say, for 3 days in a row, we have hit record numbers of vaccinations in the state, and 10,000 more yesterday than the day before. In fact, as of today, of the vaccines directed by the state of Illinois, over 60% have been reported administered, and another 10% have likely been administered but have yet to be reported. Unfortunately, the same cannot be said for the Federal Pharmacy Partnership Program for long-term care facilities, set up under President Trump. I'm very troubled to see the slow pace of the federal government's program to vaccinate long-term care residents. And I have expressed that concern to the Biden administration and to the pharmacy partners. They must accelerate the pace of vaccines to our most vulnerable residents. As of today, the federal government has set aside 524,050 doses from the overall number allocated to Illinois for the purpose of vaccinating long-term care residents. But only 93,683 have been administered by the federal government's program. That's less than 20% of their supply. After discussions directly with those pharmacy partners, they have pledged to vaccinate at all skilled nursing facilities and assisted living facilities by February 15th, with second and third visits in the subsequent weeks to assure full coverage to residents and staff. As of now, nearly all healthcare workers in Phase 1A have been provided the opportunity to get vaccinated, while the federal effort to vaccinate residents at long-term care facilities continues, although not nearly as quickly as I would like. This meets our criteria to substantially complete Phase 1A. So starting this coming Monday, January 25th, the entire state is moving to Phase 1B of our vaccination administration plan, as our very limited allotment allows. This means you will be eligible to get vaccinated if you're 65 and older, and if you're a worker who is classified by the CDC as a frontline essential worker, such as teachers, first responders, and grocery workers. This does not mean, however, that right away you will be able to get the vaccine as quickly as you have in the past gotten your flu shot. Because federal vaccine production was hampered by the failure of the previous administration to properly invoke the Defense Production Act, vaccine supply is limited all across the nation. There are additional vaccines in the pipeline that may soon see FDA approval, and that will help. But there are 3.2 million Illinoisans in Phase 1B, so there will be far greater demand than supply for at least the near term. To put it in perspective, we're expecting approximately 126,000 first doses to arrive next week outside of the city of Chicago. That's less than 4% of the 1B population. Until the vaccine supply improves, we will all, frankly, need to be patient. But we are building capacity so that as vaccine increases, hopefully over the coming weeks, we will be ready. Starting Monday, our National Guard sites, as well as local health departments and many pharmacies, will be taking appointments for those in Phase 1B, including at Walgreens, CVS, and Jewel Osco, with hundreds of sites coming online. By February 1st, additional pharmacies, including Hy-Vee, Mariano's, and Kroger, will join them. As we increase capacity to make vaccine widely available, we will launch a statewide website to provide more information so that you can make an appointment to get vaccinated. Already today, the Walgreens appointment website is up and running, and the others will soon follow. Although appointments will be hard to get for some time, times will become more and more available to you to make appointments for, as our state receives increasing numbers of doses. Because of the supply limitations, I want to reemphasize that vaccinations will be given by appointment only. So don't try to line up at your local store or call your local pharmacy. When we have a steady stream of vaccine coming in from the federal government, we will launch walk-in locations and round-the-clock operations. As the nation awaits greater supplies and ramps up vaccination sites, every Illinoisan can do their part to fight this pandemic with the tools we know work: masking and distancing. And over the last 8 weeks, we've all used those tools and made real progress bringing down our COVID hospitalizations, our positivity rates, and our daily COVID-19 cases as a state. Our statewide positivity is the lowest it's been since mid-October, And while COVID-19 hospitalizations are still more than twice what they were this summer, they are now almost half of our fall peak. Enormous sacrifices are being made to achieve this progress, but those sacrifices are truly making a real difference. Thank you. Thank you to everyone who is doing their part. This also means that our regions have achieved reduced mitigation levels based upon the metrics that IDPH set out. New as of today, Region 4 has improved to Tier 2 mitigations, meaning that now all 11 of our regions have seen meaningful enough improvement to exit our strictest mitigations. 2 more regions, Cook County and Chicago, are on track to move into Tier 1 tomorrow, which would allow for limited reopening of bars and restaurants. And some regions have made enough progress to advance to Phase 4, which is a level of reduced mitigations that we achieved last summer. My administration has worked with public health officials to balance supporting the economy with keeping people safe, and will continue to do so. And in a few moments, Dr. Ezike will walk you through new sports guidance, allowing expanded levels of play for youth and adult recreational sports for regions that reach Phase 4. I'm very pleased with the progress that we're making as a state, but I want to remind us all that we continue to live in a perilous moment. Look around the nation, outside of Illinois, and you'll see the pandemic at its worst in many places. The risk of a resurgence in Illinois, particularly with extremely contagious new variants, is serious. Our ability to have limited indoor restaurant service and to restart youth sports could be cut short if we aren't extremely careful. The CDC is already warning that the faster spreading UK variant could become the dominant strain in the United States in March. And a virus that's more contagious ultimately results in more cases, more hospitalizations, and more deaths. Yet on a more hopeful note, that same report noted that if we take proven measures to reduce transmission, like mask wearing and ramping up our vaccination rates nationwide, we can tamp down infection rates into the spring, even with the UK variant. I know none of us want to see another wave of COVID that brings on more mitigations, so let's not let our guard down. With cautious behavior, we can keep people healthy and power through these final months of the pandemic together. Now I'd like to take a moment to update you on our efforts to provide economic relief to our small businesses, particularly those most in need. Illinois' Business Interruption Grant Program, the largest of its kind in the nation, delivered a record number of grants to rural, micro, and minority-owned businesses statewide. It saved jobs across the state. There's more that can be done, though. Last week, the federal government's Paycheck Protection Program, or PPP, reopened with another $280 billion in forgivable loans, offering another opportunity for small businesses to unlock emergency funds. Of course, that's easier said than done. We know from past rounds that the federal PPP has presented tremendous barriers for very small businesses and those that are minority-owned, since both tend not to have the in-house navigation expertise of larger corporations. That's why we're beefing up assistance to all small businesses in Illinois, so anyone eligible gets access to this next round of federal PPP funds. I've directed my administration to provide community navigators through our small business centers, to our small business development centers, to work directly with our small business owners, helping them access the dollars they deserve, with a special focus on businesses who haven't received aid from the state, because we know the need is still so great. Our community navigators will sponsor more than 100 webinars in the coming weeks, offer virtual office hours in every region, support for local chambers of commerce, and collaborate with local governments to raise awareness. To learn more about getting help accessing federal PPP money, visit illinois.gov/DCEO. Our small business development centers and community navigators will also serve to support small businesses who qualify for the soon-to-launch Federal Economic Injury Disaster Loan Program for hard-hit businesses in low-income areas, and the Shuttered Venue Operator Grants, providing support for theaters and cinemas, concert venues, and more under COVID-19 stimulus authorized by Congress last month. So the bottom line is this. Illinois is focused on vaccine administration, maintaining strong healthcare and hospital systems, and scientifically based public health mitigations, but all the while building toward the economic recovery that we all know we need by helping job creators survive and thrive as we work to overcome this pandemic. So thank you very much, and with that, I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Ezike.
Thank you, Governor, and good afternoon, everyone. Over the past 7 months, I've received countless emails, letters, phone calls from students, from parents, from coaches, many others about youth sports. There have been organized protests about the issue. I hear and I see and I feel the passion around youth sports. I take very seriously the value that recreational outlets offer the physical and the mental health of our children. I also take very seriously the need to protect them, as do their parents and their coaches and the broader communities. So we are looking at how we can all play safely together, and we will talk about that now. The updated sports guidance that we are releasing today outlines the level of play allowed, dictated by the current public health conditions that we find ourselves in. We have to think about the amount of virus circulating in the communities. We have to continue to think about the test positivity, the people in the ICU with COVID, and as well as other metrics. The guidance outlines when only trainings can be permitted versus when intra-conference play can be allowed. And then at the highest level, when tournaments and championship games across leagues can be permissible. As has been the case throughout the pandemic, we can't change the fact that there are different sports and they have different levels of risk. Sports like basketball or football or wrestling pose a higher risk compared to those such as track and field or baseball or gymnastics. So we can and have to make adjustments to best balance the ability to play and the need to stay safe depending on the conditions in the community. And so that's where everyone comes in to continue, as the governor has implored, continue with the masking and the safe choices that will allow these numbers to continue in the downward right direction. So moving forward for all the regions that are in phase 4 already, and as of today, that is regions 3, and as well the regions 5 and 6. So regions 3, 5, and 6 are currently in phase 4. We do hope for more regions to join them. All sports will be allowed to play at the intra-conference region or league levels. I hope that we'll all use the experience that we have garnered as we go forward so that we don't, in fact, see another surge and go back into higher levels of mitigation that would suspend these levels of play. Reduced mitigation does not mean abandoned mitigation. Businesses, restaurants, events, and activities still need to have reduced capacities. People still need to avoid large events. We still need to use our masks all the time. We know that these things worked. It's just a plain fact. And so we need to keep doing what will work to keep our numbers down so we can continue having sports and having indoor dining as those requests. I'm also cautious, as the governor mentioned, that as we begin to see these other variants of COVID-19 spread, we have another threat against these numbers that we've worked so hard to bring down. Early studies have shown that the variant first detected in the United Kingdom spreads more quickly, and that could cause our case counts to skyrocket in a very short period of time. We've also heard of variants coming out of South Africa, and yet another in Brazil, another in Nigeria, and we suspect that those variants identified will continue to increase. We know that viruses constantly change, and new variants of the virus are expected. We must continue to stay on guard as the virus that causes COVID-19 mutates and as these new variants are in fact detected. We will continue to perform genomic sequence testing on more and more specimens to help detect these variants and their potential spread. In the last 24 hours, more than 125,000 COVID-19 tests results were reported, for a total since the beginning of this pandemic of more than 15.2 million tests. Overnight, in the hospitals across Illinois, 3,179 individuals were hospitalized with COVID, and of those 3,179, 661 were in the intensive care units, and 348 patients were on ventilators. Today, 7,042 new individuals with COVID have been reported, for a total of 1,093,375 total cases. Since yesterday, we've received reports of 95 individuals who have passed from COVID, for a total of 18,615 lives lost to COVID-19. Regarding the 7,000 cases today, that number, if you note, is slightly higher than what we've been seeing. And that is due to an adjustment. We've adjusted our probable case count, and that's now included in the total cases we've just reported. We have worked tirelessly over the past year to provide the latest health guidance to combat COVID-19. And we're providing the best data we can so that people can see what is happening as quickly as possible in their respective communities. Our response to this pandemic has evolved from a year ago, and it'll continue to evolve as we continue to learn more, as we study the new variants, and as the vaccine successfully goes into the arms of the people of Illinois. What will never change is our commitment to protect the health and safety of all communities and to provide as much information as quickly as we can to all of the residents of Illinois. Our objective is simple: end this pandemic as quickly as possible. And we need your help to do that, of course. So please continue to wear your mask. Please continue to maintain 6 feet of distance. Please continue to avoid large gatherings. And let's get vaccinated when your turn is up. Thank you, and I will summarize comments in Spanish. Buenas tardes. Durante los últimos 7 meses he recibido innumerables correos electrónicos, cartas y llamadas telefónicas de estudiantes, padres, maestros, entrenadoras y muchos otros sobre deportes. También he escuchado de las protestas. Tomo muy en serio el valor que los espacios recreativos ofrecen a la salud física y mental para nuestra juventud y la necesidad de protegerlos. También a sus padres, amigos y comunidades en general de esta pandemia, para que todos puedan jugar juntos de manera segura cuando esto termine. La guía deportiva que compartimos hoy describe nuevamente el nivel de juego permitido por las condiciones de salud pública. También describe cuando solo se deben permitir los entrenamientos, cuando se permita el juego dentro de la conferencia y cuando se permitan los torneos y los juegos de campeonato. Como ha sido el caso a lo largo de esta pandemia, no podemos cambiar el hecho de que los diferentes deportes conllevan diferentes niveles de riesgo. Pero podemos hacer ajustes para equilibrar mejor la capacidad de jugar y la necesidad de permanecer a salvo. pero no más si permitan las condiciones de la comunidad. En el futuro, para todas las regiones que se encuentran en la fase 4, y a partir de hoy incluyen las regiones 3, 5 y 6, todos los deportes podrán jugar al nivel intraconferencia, región o intraliga. Soy optimista con las tendencias que estamos viendo en Illinois, las tasas de positividad y el número de gente que están en los hospitales. Todos están bajando. Soy cautelosa por un par de razones. Durante el verano vimos una caída en los casos y el estado pudo abrirse un poco más. Pero como todos sabemos, a partir del otoño vimos aumentar el número de casos, gente en el hospital y muertes. Espero que todos usemos esa experiencia y la información que hemos aprendido a medida que avanzamos para que no veamos otro aumento. Mitigación reducida no significa ausencia de mitigación. Los negocios, restaurantes, eventos y actividades deben tener capacidades reducidas. La gente debe seguir evitando grandes eventos y todos debemos seguir usando nuestras máscaras. Sabemos que estas cosas funcionan. También soy cautelosa a medida que comenzamos a ver otras variantes de la propagación de COVID-19. Los primeros estudios han demostrado que la variante detectada por primera vez en el Reino Unido parece propagar más rápidamente. Otra variante ha surgido en Sudáfrica y otra en Brasil y otra en Nigeria. Los virus cambian constantemente y se esperan nuevas variantes de un virus. IDPH va a seguir para la supervisión de estas nuevas variantes y proporcionar nueva información a medida que esté disponible. En las últimas 24 horas se han informado más de 125,000 pruebas fueron hechas para un total de más de 15.2 millones de pruebas aquí en Illinois. Desde anoche, 3,179 personas estuvieron en el hospital con COVID-19. De ellos, 661 pacientes estaban en la unidad de cuidados intensivos y 348 personas estaban en ventiladores. 7,042 nuevos casos de COVID-19 para un total más de 1,093,000 casos en Illinois. Desde ayer hemos recibido informes de 95 personas con COVID-19 que han fallecido por un total de más de 18,600 vidas perdidas aquí en Illinois. El número total de casos que se notifican hoy es ligeramente elevado. El total de casos incluye los casos confirmados como los probables. Ahora también incluye el número de muertes probables desde el comienzo de la pandemia. Anteriormente, solo las muertes confirmadas se incluyeron en el total de casos. Sin embargo, como total de casos incluyen los casos confirmados y probables, ahora se incluyen las muertes probables. El IDPH ha trabajado incansablemente durante el año pasado para brindar información para combatir el COVID-19 y que la gente puede ver lo que está sucediendo. Por favor, continúe usando sus máscaras, mantenga su distancia, evite eventos grandes y lávese las manos y vacúnese cuando sea elegible. Muchísimas gracias para su apoyo. And with that, I'll turn it back over to Governor Pritzker.
Thank you, Dr. Ezeka, and happy to take questions from members of the media.
Governor, why were healthy prison inmates moved ahead of people with high-risk medical conditions in the, I suppose, the pecking order for vaccinations?
Well, they weren't moved ahead. Let me explain to you that the ACIP committee at CDC recommended that we vaccinate prisoners at the same time that we vaccinate corrections officers. This is, in fact, not just an ASIP recommendation, but the Bureau of Prisons for the federal government is vaccinating prisoners. So too the Biden, so that was under the Trump administration. Same is happening under the Biden administration. So that's where we landed, and I'm pleased that we're able to move into Phase 1B. We have, as you know, 3.2 million people in this next phase. The vast majority are people 65 and over, and we're glad to be able to get to them. And as you know, many, many of them have several comorbidities, so they're very much at risk.
Governor Pritzker and Dr. Nzik, I know I've been carrying this with me. All sports, all played. Not one hospitalization for any of the students. They played football, they played girls volleyball. These are all the states right now that have a confirmation of when they're starting basketball. The only two holdout states are Illinois and New York. They even have basketball tryouts for high school in California yesterday, and they're having them today. What are these governors recklessly endangering the lives of students, but we're not here? I mean, why are we doing this? This makes no sense.
I'm happy to allow, as you know, there are many more people who are playing youth sports today as a result of the movement between tiers and to Phase 4. Happy to have Dr. Nzik give you some answers.
So, Dr. Nzik, so if you're in Phase 4, Tier 2, and Tier 1, can you play basketball?
Phase 4.
Tier 2 or Tier 1, can we start basketball?
In
Meaning we, like the whole state of Illinois.
So it's per region, right? So it's not for the whole state. But if your region is in Phase 4, you can play basketball games.
Can we practice?
If you're in Phase 4, you can absolutely practice and play basketball
And have
games.
games?
And let me just say, this is all on the website. You can go look this up for yourself. Let me also say that, you talked about the number of children who've had COVID as a result of playing. So remember, the issue here is very much, are children carrying it home to their parents, to their grandparents, right, after interacting very closely, as you know, sometimes without a lot of padding or whatever, right, and interacting with one another. So we want to make sure we're keeping families safe. Our number one concern has always been to make sure that kids can go back to school, and so making it safe for them to go to academic classes is the thing that we've been focused on.
But I've done my homework. There is
Yeah.
not one transmittable case.
I hear you, but as you
player to
heard
coach
today, things
or
have
from coach
changed.
to family members.
Things have changed as a result of the great work that people have done across the state following the mitigations, and so there are many more people playing sports today than yesterday.
There are also documented outbreaks of sports-related outbreaks in other states, so I'd urge you to Google that. We're going to move on, so you can go, Chris.
Governor, the IDPH Twitter profile has regions 10 and 11 on track to advance to Tier 1 on Saturday. There's a lot of restaurateurs in the Chicago suburbs and in the city wondering, will that happen for tomorrow? We have the numbers today. When will we know about tomorrow?
I'll let Dr. Nzik, because she's been tracking these numbers.
So we will be able to know tomorrow if they, in fact, meet the criteria. It's looking like they will get there, and so that announcement will be made tomorrow, whether it's confirmed that 10 and 11 have reached Tier 1.
Can I ask you one other question while you're up
Please.
there? There's been a lot of blowback that some high-profile Illinoisans have been getting vaccine ahead of others who might be in more need. Can you speak to the conversation that's brewing in Illinois about line jumping for those who should be getting it in the proper order?
Yeah, no, I appreciate that question. So we have a clear set of guidance. We have had teams of people within IDPH work with infectious disease consultants, moral philosophers, bioethicists, to really look at the guidance that was given by the ASIP and then see if there were any adjustments. So we're very proud of the document that we've had, and we've worked really hard to make sure that there are no, that we're not making exceptions just based on, requests from other individuals. So we have it clear, and all of the individuals in the state that are supposed to be giving out any of the COVID vaccine are supposed to be following and adhering to those guidelines and recommendations. Does IDPH have the ability to look at every place that vaccines are administered to make sure that no one was inappropriately given a vaccine? no, but we are collecting as much data as we can, and we are asking that people certify, which group they actually belong to. If someone says that they are, of a group that they're not, do we have a way to really mitigate that? That's a little different. I think for the most part, things will follow according to the guidance, and of course, now with 1B open, many, many people are eligible. And so I think we can't work towards the exception. We're working for the greater good, for the masses, and I think for the most part, things will hold. I know that nothing is ever perfect, and so I think you have to accept that there's only so much that can be done.
Dr. Zika, can I follow up sort of along those same lines? Has the state of Illinois directed Walgreens, Osco, the other pharmacies and whatnot to stop vaccinating people with surplus doses, even if it meant the vaccines would be thrown out? And if so, where's that direction coming from?
So we are working on systems where everyone has to be registered ahead of time. So there's not an open call where just anyone can show up and get vaccinated. There are appointments, and so individuals have to have pre-registered so we know who's coming. I don't think there'll be any loss, any shortage of slots in terms of people not filling up the slots, given how many people are eligible now and how eager people are to get the vaccine. So I think all the people in 1A, we have 1A people that still have to be vaccinated, and then the people in 1B, those are the individuals who will be getting the vaccine, whether it's in the retail pharmacies or from their local health departments or other providers that are helping us with this COVID effort.
I think the issue was people who are in maybe the 1B category are going in and getting vaccinated now because pharmacies can't find enough 1As to come in and use up the vaccines they've got, and they don't want to waste them.
So there are differences, and I think the governor spoke about this last week and maybe even the week before, that there are regions that were substantially done with 1A, and so they were looking around for people to vaccinate, and so it was permissible for those regions that were substantially done with 1A to move on. So there are some areas of the state that have already begun vaccinating 1B.
Governor, with these Illinois National Guard vaccination sites, you said 6 in Cook County, 25 other places. Is it a first come, first serve? How like we saw in Florida, people
No.
are driving in?
As we just said, it's all done by appointment. It's all done by appointment now, right? As long as we have a shortage of vaccine that is coming from the federal government, right? We don't want to have that happen. That's precisely something that everyone is worried about. And so we've got appointments. That's what Dr. Zika was talking about. People sign up on a website in order to get an appointment so they can show up at a specified time, typically 15 to 30 minutes, because you have to be observed after you get it for about 15 minutes.
So you tweeted out about the metrics changing and that there's multiple healthcare staffing contracts that increased hospital staffing. Where are these nurses and doctors going?
As needed. It's a contract in place for hospitals as needed. You're not going to throw a bunch of skilled healthcare workers into a hospital where they're not needed. So it's a contract that gives us a reserve in the event that there are hospitals that are understaffed.
All right, we'll do one more in the room and we got to get online. Go ahead.
Actually, Congressman Rush tweeted yesterday that he's writing the Small Business Administration with an issue about PPP recipients not being eligible for more funding because they've received forgiveness in the first round. Do you know anything about that?
I don't. That's a federal matter.
Sorry, I just thought.
That's okay. That's okay. I just don't happen to know about the problem of the first PPP program affecting the second.
Okay, and I've actually got a question for Dr. Ezike,
Yeah.
if I can ask. I'm working a lot on the CDC's report from last Friday regarding the estimate or the projections that the B.1.1.7 variant is going to be the dominant variant in the United States within 6 to 8 weeks in March. From an epidemiological standpoint and a public health standpoint, it's a new variant. What do we not know about the variant that you wish you knew at this point that would be useful for you in your job right now?
Well, I think we know enough to understand what precautions that we all need to take. So this is not the time to suspend using masks. So if something is more transmissible, that would suggest that we need to double down on mask wearing. If something is more transmissible, then that would mean that larger gatherings are even more dangerous than they were before. So even as we, learn more about, this variant and maybe how it will do against the monoclonal antibodies, et cetera, there are things that don't change as we're learning more about the variant. And so those important things are the things that are going to make the difference. Continuing to be masked, it's not inappropriate to say, if I can breathe comfortably with one and I can do that with two, maybe two will give us that extra level of protection. That, large gatherings, unmasked, indoor, obviously more risky than outdoors, like all of those things we've been saying, the message doesn't really change. It just means it's more important now, more important than even before, to adhere to them. So we'll continue to follow the science. I have colleagues in the UK that I converse with regularly, and it's very helpful to get, their information as well. We'll continue to use that information, what our colleagues have seen, to make sure that we're keeping a close eye and that we're giving all the appropriate guidance and making sure that we don't react too late. So if we do see a surge in terms of the UK variant, we know that it starts to multiply very quickly once it takes a significant hold. We know the numbers now are very, very low, but that can change. Like you said, in March, we think they could become the predominant variant. So we'll be watching to figure out the time that we will have to take more aggressive steps to curb its continued spread.
Thank you.
All right, Hannah Mizella at NPR Illinois. Can you elaborate on this new website the state is setting up? Is it actually going to facilitate making appointments or merely link to places where people will make appointments? Additionally, not all seniors are computer literate or have the internet. Will the state at some point set up a hotline to assist them? What about seniors who don't have access to transportation? And will the state set up a program to help them?
Wow, that's a lot of multi-part question. Let me start by saying that people will be able to go to a website that will get them to either their local public health department or to a pharmacy where they can sign up for an appointment. So people who are able to get online, and that's the vast majority of people. People who are not have the ability now to call their local public health department and get more information. And that's, at least at this point, if they have a question, they can do it that way. And we certainly want to make sure that people have access to information if they're not computer literate. So in addition to that, there is a number that you can call, coronavirus hotline at the IDPH, that will direct people.
Jamie Monks at the Tribune. Given what you've learned during Phase 1A of vaccine distribution and what you've seen of the Biden administration's plan, can you provide an estimate for how long it will take to get through Phase 1B in Illinois? When should the general population reasonably hope to see vaccine availability at this point?
I know I'm going to get asked this question virtually every time I stand up here. People want to know, when exactly are we going to move on to the next phase, or when can I get mine, is what people are saying to themselves. And it is frustrating, I must say. Very frustrating for us, because if we had more vaccine, we have the sites being set up all across the state to be able to administer more and more vaccine. That is what we're prepared for. And so more vaccine arrivals, deliveries to the state of Illinois will be extraordinarily helpful for us. And I can't tell you an exact date. I think it would be irresponsible, in fact, to set a date and tell you that that is when everybody is going to be vaccinated, or every adult, or even in the next phase 1C, because until we see what vaccine production and deliveries will look like, it's impossible to predict.
Were you encouraged or discouraged when Dr. Fauci said yesterday life would likely get back to normal by the fall?
I don't know whether I was, I mean, I don't think I was thinking of whether I'm encouraged or discouraged. I think every day about how challenging it is that we don't have enough vaccine. And so I guess he knows more about what's going on inside the administration, I suppose, on vaccines than I do. So I guess that tells me that, that they are ramping up as fast as they can. But I know that a few months ago, he felt like, by late April. But that was with promises from an administration that, frankly, has never lived up to its promises.
Joel Ebert at the Daily Line. With new strains of the virus in Illinois and the U.S. and vaccine distribution not yet at levels you'd prefer, why is now the right time to reduce mitigation throughout Illinois? Is it possible we could see a return of increased mitigations if there's wider spread?
It's always been the case that if we see resurgences, that we're going to have to bring back mitigations. That's always been the case. We set metrics for that purpose, to set triggers so that we would know, everybody would know, that it isn't just a random question, and that, our doctors are on it at all times to make sure that, yeah, if the UK variant, I think Dr. Ezike said it brilliantly, if we see signs that the UK variant is overtaking what we've already seen of a coronavirus in the United States, and that caseloads are beginning to surge at rates that we haven't seen before, then obviously we'll be moving into different mitigations.
John O'Connor at the AP. Do you like the idea of FEMA sites in Illinois? Would that mean more vaccines or just better distribution?
Well, by itself, just to say there's a FEMA site doesn't mean more vaccines. It definitely means more distribution. And so more distribution to the state of Illinois with more sites, that's what we need.
Jake Griffin at the Daily Herald. Senator Durbin acknowledged today that he is disappointed by how few nursing home workers are willing to be vaccinated. What's being done to convince these workers to vaccinate?
Yeah. So we have not only a social media campaign to address them, but also we've talked to the union representatives, for example, for many of these folks to make sure that they're communicating to their union members. We've talked to the nursing home ownership to make sure that they're communicating to their workers. And we'll continue to, we're running a campaign. I know that the federal government is about to, or is looking at the Biden administration to run a national campaign to convince people who are vaccine hesitant to get vaccinated. I will say that if I have any optimism here, it's really because I've heard people tell me that they're concerned about taking the vaccine because they don't know anybody who's had the vaccine yet. And they'd like to hear their neighbor tell them that they had it and it was fine, and then they'll go do it. Or that their doctor says it's okay and they haven't had a chance to talk to their doctor yet. So I think that kind of hesitancy can be overcome fairly easily.
This is for Dr. Ezike from WAND News in Decatur. In central Illinois, regions 3 and 6, we've seen people line up for hours and even spend the night to get a vaccine. Most of these are 65 and older community members. What is your reaction to seeing the long lines, and when can we expect more vaccine?
We're not making the vaccine, so I don't have control on when we'll soon more. I'm familiar with some of the vaccination sites that are happening in 6, and so I know that each of those individuals have appointments, and I also know from talking directly to the public health leaders there that even though people had a vaccine appointment for 11 o'clock, they showed up at 8 o'clock anyway. So we just need to continue to message, because it's just the eagerness. Everybody's so excited to get this vaccine, but we do need to message to our population that we don't want to inadvertently create a situation where they catch COVID while waiting for their vaccine 3 hours later. So we need to come at our appointed time. We need to make sure that we message to our communities that that time is their time and that it is the time that they will get the vaccine, and they don't need to come 2 and 3 hours and queue up because they already have an appointment. And so I think, this is new. People want to make sure that, they told me 11, but maybe other people might come in and try to do a walk-in and take my... We want to rest assured that those appointments are going to be adhered to. People cannot come in off the street as a walk-in and take your vaccine, so you don't have to queue up or be waiting in line for hours before your time. I think people will get to know that as we move forward, but I understand the excitement and the fervor around getting their vaccination.
Can I ask a follow-up on that, Dr. Ezike? Obviously, it's Friday. 1B starts Monday. There's thousands of people right now listening and watching saying, what is that website? Where do I go? Where do I sign up to give that safety and that sense of security? Can you elaborate a little bit more on folks who right now want to plan their Monday or plan a week from Monday?
Yeah, so just to be clear, there is going to be on the coronavirus website information, and somebody was asking, is it links? So there are going to be different links. Some will be directly to pharmacies, some will be to our platform, this EM Track, where the local health departments are putting in information about their pods. Some of them are specified where they've already targeted a group and said, we are still working on, dentists in the community who didn't have an appropriate way to get vaccinated as part of 1A. And so only those dentists that were trying to be targeted will have that link to sign up. But when there are, the additional open to the masses, and I know it's confusing and it's also frustrating that, yes, I'm going to be eligible as of Monday, but I can't get it on Monday. And unfortunately, that is the message. When we get about 120, maybe 126,000 doses next week for a pool of 3.2 million for 1B, plus the remnants of that first pool, we have almost 4 million people that are eligible. So I need people to understand that, yes, they're eligible, but no, they might not get it this week or this month. And so we will, as we have all of that information and those pods, we will be able to have people linked to it, but it's not in abundance now where everyone can sign up. And I
What's the
think.
website, though? What website?
Coronavirus.illinois.gov.
And they can make reservations, or they
They
can
will
put,
be able to go on there and.
can
as
you
I
say
said-
that?
Oh, I'm
No,
sorry,
sorry.
I apologize. Yeah, it's coronavirus.illinois.gov is the website, but they'll be able to go on there and link to whatever is closest to them, a pharmacy partner or a local public health department or some other.
So it's a series of links. It's not a.
It is, but it's because whoever your providers, whatever's closest to you is going to be different than whatever's closest to Craig Wall, for example.
Rachel Hinton at the Sun-Times is asking about the Republicans who held a press conference today calling for you to halt your push for decoupling legislation, saying it would hurt struggling Illinois businesses during the pandemic. What's your response?
Well, I think what the Republicans misunderstand is that the Senate Majority Leader, former Senate Majority Leader, Mitch McConnell, and the former President, Donald Trump, pushed for legislation giving a massive tax increase to some of the largest businesses. That what they also did was affect state revenues across the United States, which is why 26 states have put through decoupling. An additional 9 states already were automatically decoupled, and other states that don't have an income tax were not affected by decoupling. So it's really actually a fairly standard movement by states to make sure that they're decoupling, and we're going to do the same. The Republicans were now 81 days since Election Day. They've not proposed any cuts to state government, any way to balance the budget, and now they're proposing blowing perhaps a $500 million hole in next year's budget.
Stephanie Goldberg from Cranes is asking if we could provide more information on the vaccine doses administered to people from out of state. Where do most of these people work and live, and are they primarily healthcare workers?
So Illinois, of course, by virtue of our position in the country, is bordered by multiple states, right? And so we have many people that live in Indiana and work in Illinois. Same with Missouri, same with Wisconsin, same with Iowa. So we have those situations. I've talked to all of my peers in the bordering states. None of us are going to get into, well, you don't live here, but you work here. If you work in my office, we are swapping air together regardless of where you put your head down to sleep at night. And so we are all protected in this work environment if we are vaccinated. So making that distinction between the fact that you work with me and swap air with me, but you don't put your head down in the same state with me is irrelevant and not productive and is not going to protect our community. So we are saying that, if you work here, you reside here, yes, you will take advantage of this vaccine, and that will help our communities be safer.
All right, we've got 2 more questions. Dr. Zike, you could stay there. This one's for you. Some regions went from Tier 3 all the way down to Phase 4 immediately with the adjustments to the mitigation metrics earlier this week. Can you please explain this decision, and how does the state's surge staffing program make up for the number of hospital beds?
So no group, no entity, no region went from Tier 3 to Phase 4. That's not correct. And then the second part of the question?
Can you explain how the state's staffing contract helps make up the hospital bed?
Right. So we know that there are some areas of the state that are struggling. Like they do have fewer beds available in the med surg department, and so being able to get additional staff to staff beds makes all the difference in the world. Anyone can put a bed in a room, in an empty space, can convert an empty wing into a medical floor. It's not the beds that are necessary, it's also the people that will staff those beds. And so by having access to our statewide contract, you can now have access to get a pool of staff that can staff beds as necessary. And so that's why we can know that even if med-surg beds are lower, we will be able to support individuals that need to get the staff to be able to turn over new beds and create more availability that way. It's a lot harder to create an ICU bed because of the intense amount of equipment, the high-tech equipment that's necessary. That's not as easy as creating a medical surgical bed.
All right, the last question is from Mike Militich at Quincy TV for the governor. While last year was challenging for so many due to the pandemic, cannabis sales were a huge success. How do you feel today being able to get the first R3 grants out to the communities in need?
Well, I think it's terrific. It was what was intended in the legislation to begin with. It's part of the effort to address inequities across the state. It's also an effort to address the failed war on drugs. So I'm elated, and I have to say that the Lieutenant Governor did a terrific job leading the R3 board, making sure that we're getting those grants to the right places and the right people in disadvantaged communities to address those wrongs.
All right, thanks
Yeah, but
everyone.
Governor,
Thank you.
One follow-up on
One more question.
restaurants.
Dr. Zike.